Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through September 8th, 2022. This time of year, we're reminded that there are things going on besides COVID and monkeypox, and unfortunately also besides football rankings. And one of our viewers asked if we would provide an update about influenza, since we're about entering into the season. So quick background information. Influenza, also called the flu, is a seasonal viral disease. It's usually spread from person to person very quickly. You'll get sick in 1 to 4 days, usually 1 or 2 days after exposure. And the symptoms are usually pretty consistent: fever, cough, sore throat, runny nose, muscle aches, headache, tiredness, and in kids, GI symptoms. You don't always get all of these, and it is possible to have flu without fever, for example. But characteristically, these hit quickly. You go from feeling pretty well to feeling pretty lousy quite quickly. Now, a flu can cause complications, and in the U.S., there are on average about 35,000 deaths every year. But as you can see, over the past decade or so, the number of deaths fluctuates from a low of 12,000 to a high of 52,000. Globally, it's a more serious problem with 290 to 650,000 deaths a year, according to the World Health Organization. It's transmitted as a respiratory virus, so breathing, talking, coughing, sneezing, but also contact with contaminated surfaces, particularly the idea that if there's a live virus on a surface and you touch it with your hands and put your fingers to your eyes or nose, you can get it that way. Animals and birds do harbor influenza viruses, though it's relatively unusual for humans to get influenza directly from animals, so that it can happen. And that's one of the things that we worry about, right? Avian flu, swine flu, and so on. Important to understand that, as we've learned with COVID, viruses change over time. And historically, the influenza virus that is spreading most widely evolves over time. So someone could have influenza one year and get it again the next year. Both in the United States and globally, we are still in a slow part of the season. We would expect it to pick up pretty quickly. So CDC recommends 3 types of actions to protect against flu. They recommend vaccination, preventive action, and treatment. In terms of vaccination, they just came out with an ACI Advisory Committee on Immunization Practices report just about a week ago. And they say that routine annual immunization is recommended for everyone over 6 months of age. And they make no recommendation over which type of flu vaccine to use, with the exception of folks over the age of 65. They say that most people who need only 1 dose should ideally be offered the vaccine during September or October. I typically try to get it in late September, early October, sometimes mid to late October, depending on what's happening, to try to get a sense of what's going on epidemiologically around the world. There are some of the approved vaccines for children that require 2 doses. So you do want to check with your healthcare provider. And the ACIP, Advisory Committee on Immunization Practices, recommends that folks over the age of 65 receive one of the higher dose vaccines. People with chronic medical conditions, like those who are immune compromised, who are pregnant, have COVID-19, should check with their healthcare provider as to which type of vaccine they should get. It's important, however, that people do get vaccinated. Right? People at higher risk of developing serious complications, including young children, pregnant women, certain chronic conditions, older folks, healthcare workers, and those who take care of or work with high-risk people, really should get vaccinated. So while it may require an extra phone call to a healthcare provider to figure out what vaccine you should get or when you should get it, if everyone should get vaccinated, and if you're in a high-risk group, you should be very careful to make sure you get vaccinated at the time that's appropriate based on what your healthcare provider tells you. Once you're vaccinated, you can still take appropriate preventive actions. These are going to look very familiar because they are very similar to recommendations about other respiratory viruses like SARS-CoV-2 that causes COVID-19. So first, avoid close contact with people who are sick. If you are sick yourself, please limit your contact with other people. Cover your nose, mouth when you cough or sneeze. Wash your hands often. Avoid touching your eyes or mouth or nose. And clean surfaces that may be contaminated. The CDC recommends that you should stay home for at least 24 hours after your fever is gone, except in an emergency situation to get healthcare or other necessities. And finally, in terms of treatment, there are certain antiviral drugs that can be used. You do need to go to a doctor to get them. Antiviral drugs are different from antibiotics. If you have some antibiotics at home lying around, do not take them for any reason, but especially don't take them for flu. These antiviral drugs can make the illness shorter and can make it milder. They may also be able to prevent serious complications, but they need to be started earlier if possible. And if you are at high risk from complications of flu, please, if you develop symptoms that seem like flu or COVID, let your healthcare provider know. So the CDC recommends 3 types of actions, vaccination being the most important, preventive actions, and treatment. They have these nice little graphics about what you need to do to fight flu, what to do if you get sick. Probably the last item there on the right is the most important, stay home if you get sick. So obviously there's a great deal more information about other public health issues, COVID, monkeypox, climate change, gun violence, many other issues on the College of Public Health website. Please feel free to share these videos. If you know someone who'd like to be added to our mailing list, please let me know. Thanks as always to Dara Young for editing, producing, posting, adding captions, and posting this video. And most importantly, if you have any questions, this topic this week was brought up by a viewer. I hope it was helpful. But if there's other issues you'd like to talk about, please let me know. I look forward to hearing from you. Until next week, please be well.